The cells in your sediment of your urine include the following. Bacteria, sign of urinary tract infection. What kind do we talk about over and over again? E. coli. What are you going to find? Nitrites, right? Nitrites. And sensitivity, quite low. Specificity, quite high. RBCs. Examples, renal stone, cancer, bladder, or renal. Stop here for 1 second. If there was a RBC of a particular shape, known as a dysmorphic RBC, well, that RBC would be probably more specific for what kind of damage? Glomerular damage. But if there was a renal stone, maybe there was a transitional cell cancer, squamous cell cancer, adenocarcinoma of the cancer of the urinary bladder. Could you result in RBCs being found in the urine? Of course you could. Renal, hematuria, RCC, renal cell carcinoma. Yes, you could. Glomerulonephritis, more so with what type of glomerulonephritis? Nephritic or nephrotic? Good. Nephritic. And I told you earlier with nephritic, you probably want to focus upon the letter H. Give yourself one little clue in which you start the cascade of symptoms. Hypertension, hematuria, RBC cast, that's nephritic. And nephrotic, oh, you pay attention, letter O. Why? O representing vast or large amounts of protein being lost. Talk about dysmorphic, this we already did. If you have an RBC that's passing through the glomerulus, it might get disfigured. Mal-shape, and then morphic would be your actual morphology. So, misshapen RBC, glomerular. Continue. Neutrophils, urinary tract infection, sterile pyuria, both. Make sure that you differentiate between the two. Do not just read through this. Urinary tract infection, you would find there to be pyuria, and you would also find there to be esterase, and you would find there to be positive culture. Sterile pyuria, give me two big examples. Chlamydia, and was the other one? Something like drug-induced nephritis. Pyuria refers to what? Greater than or equal to 10 WBCs by high field type of microscopy. In a centrifuge specimen, or greater than or equal to WBCs in an uncentrifuge specimen. So centrifugation becomes important to you in terms of laboratory settings with the neutrophils. Oval fat bodies. Here, right off the back, you should be thinking about nephrotic syndrome. Now, let me give you a concept here, okay? As I love to do. It's the fact that if you have, for whatever reason, if you don't have enough protein in your body, you have an inverse relationship with lipid accumulating in the body. Once again, for whatever reason, if you are not having enough protein in your body, you will have an increase in lipid in your patient. For example, nephrotic syndrome. You're losing greater than 3.5 grams of protein per day. Thus, your patient has hyperlipidemia. Because this is occurring in the kidney, you would expect to find oval fat body. Another name, perhaps you've known, nephrotic at times is lipoid or lipoid nephrosis. Let me give you another one. Say that your patient has cirrhosis. You can't make protein. Oftentimes your patient will have hyperlipidemia. That you already know. And then, of course, say that you damage your rough endoplasmic reticulum. Rough endoplasmic reticulum, down in the organelle in your cell. You can't produce what? Protein. May result in hyperlipidemia. Do you see the parallel that I have just given you when dealing with not enough protein, increased lipid? This is specifically in the kidney, and I'll show you a picture of oval fat body. Let's continue. Important section on cells. Cells versus casts.